battle against COVID-19 has plenty of Michigan businesses just scrambling to deal with new vaccine mandates. And we'll have more on the new HR challenges in a second, but first, a snapshot of where things stand today. The state is reporting more than 6,000 new cases over the past 3 days. That's an average of just about 2,000 a day. The state is also reporting an additional 29 deaths blamed on the virus, plus 70 new outbreaks in schools, which means 2 or more cases from different households who may have shared exposure on school grounds. President Biden threw down new vaccine mandates Friday. Today, Paula Tutman tells us the battle for vaccine compliance actually goes back hundreds of years.
Yeah, Karen, this is so incredibly complex in terms of employees and retention, employers and enforcement. And as you said, this is not necessarily new, this whole idea of vaccine resistance. Revolting against vaccines is not new. It is part of the DNA of our global history, according to Dr. Mark Navin, a medical ethicist with Oakland University and Beaumont Health.
England in the mid-19th century was mandating smallpox vaccine for everyone in their country, and there were riots. They were like government buildings burnt down. And so they introduced, in order to sort of have a pressure escape valve for this real anger people were feeling, they introduced conscientious objections to their mandatory vaccine laws.
And in fact, Dr. Navin believes opt-outs or exemptions, whether medical or religious, are a necessary relief valve to keep the pressure cooker, that is the battle over vaccine mandates, from blowing the lid off the so-called political and social pot.
It's imperfect. It's not what I would want. I want everyone vaccinated, but I would rather have almost everyone vaccinated and a few people opting out than trying to force everyone to get vaccinated and heightening the polarization and political conflict about that.
The vaccine mandates working their way into law are an HR nightmare, according to human resources expert Debbie Ritter, the benefits specialist for UHY Consultants.
It's very difficult on the HR teams. I think HR teams could be very polarized within their own team on the subject, based on people's beliefs or how they're being influenced or what they're listening to.
But in a climate where employers are already fighting to find employees and keep employees, the catch-22 for employers, mandated to mandate the vaccine, is the catch-22.
I think it is a really hurdle for a lot of companies. There's not enough people to work the Chick-fil-A's and the Arby's and things, and you see them limiting hours or cutting or you're standing in line for twice as long, 3 times as long. It has such ripple effects through the corporate America that touches almost every aspect of things that have already been very hot topics in our news today regarding wages, minimum wages, everything we touch, this will impact.
So when you think about that phrase, it's complicated, you could look in a dictionary and this example of vaccine mandates would be the poster child for that phrase. It really is just that complicated. We're talking about unions, we're talking about political beliefs as well as religious beliefs. Listen, one organization has really played hardball on this, and that's one of our local hospital systems. Tonight at 5, I take a look at where they're going with their mandate, how they're doing, and what they consider their successes, in fact, Karen. So I'll see you back here in I don't know, 45 minutes or so.
All right, we look forward to it. Thank you, Paula.